Today's forum represents the spirit of collective problem solving that is necessary to stem and then reverse the tide of this truly horrible epidemic. As you all know, the heroin and opioid crisis is the most pressing public health and safety challenge facing our state. According to projections by the Chief Medical Examiner, and you've heard them already this morning, more than 400 Granite Staters died from a drug overdose last year, with the majority of those deaths caused by fentanyl, heroin, or another opioid. And thousands more have overdosed, their lives saved only by the quick action of first responders, medical providers, and their family and friends. Everywhere I go, I hear from people who've been affected by substance abuse. It touches people from all walks of life, and it counts for billions of dollars in negative impacts on our economy. Our law enforcement officials work together every day with our federal partners at the DEA to address the supply side of the issue. Thanks to their collaboration, we have seen significant success in arresting drug dealers and in seizing illegal drugs. While we will continue to look for additional creative ways that we can make more resources available to support law enforcement, we all agree that we cannot arrest our way out of this problem. We certainly have to stop the supply of these dangerous drugs entering our state. But it is absolutely critical that we address the demand side of this issue as well. We must all work together every single day on a comprehensive approach to combat this crisis. A comprehensive approach that includes supporting law enforcement while focusing on strengthening prevention, treatment, and recovery efforts. In Concord, we continue to push for measures in order to give patients, providers, parents, and law enforcement better tools in the fight against heroin and opioid abuse. In November, I proposed to the Executive Council, and they agreed, that we should call the Legislature into special session to consider comprehensive substance abuse legislation. And since then, a joint task force of the Legislature has recommended expediting a package of bills to get to my desk for signature later this month. The bills include measures to crack down on fentanyl, which was the major cause of overdose deaths in 2015, and as you have heard, is more lethal than heroin. The bills include bills that ensure that the laws and penalties for the distribution and sale of fentanyl match those for the sale and distribution of heroin. The Legislative Task Force also supported legislation to streamline access to treatment by requiring all insurance companies to use the same evaluation criteria and removing prior authorization requirements in certain cases. And among other steps, the task force also supported bills aimed at strengthening our prescription drug monitoring program, mandating greater use by prescribers, expanding access to the program, and permitting state funding for it. I applaud the Legislature for its hard work over the last 2 months, and I look forward to the full Legislature passing these bills as quickly as possible so that I can sign them into law. While this task force work is an important step forward, we know that the fight against addiction is ongoing, and we have to be constantly working to strengthen our efforts. I'll continue to push for additional changes, although some of these changes may be difficult. These changes require us to ask people to change the way they have always done things at a quicker pace than they would sometimes prefer. Some of these changes will require additional resources and dollars, and there may be those who say we can't afford to invest in it. I say we can't afford not to. Every month, we lose dozens of our fellow citizens. Our families lose their loved ones. Our businesses lose valuable workers. Our future shrinks before us. Combating this crisis continues to require urgent action. There remains broad bipartisan consensus around other items in the comprehensive proposal that I made to the task force. We can't afford to wait to take some common sense steps. So I'll continue to advocate for these proposals. They will help save lives, and we need to move forward with them as quickly as we can. It's clear that we need to provide additional law enforcement support to our hardest hit communities, similar to the grant-funded effort underway in Manchester. And we need to continue to address the backlog that we have in the state police forensic laboratory. We must maintain our commitment to prevention, treatment, and recovery, providing additional support to the Governor's Commission on Alcohol and Drug Abuse to provide these critical services. To save lives when overdoses take place, we must continue increasing access to the safe and effective use of Narcan. Rite Aid recently became the first pharmacy chain to sign a standing order that makes Narcan available in their New Hampshire locations, and will continue to work with other pharmacies to help increase access to this life-saving emergency treatment. To help prevent the overprescribing of opioids that can lead to addiction and heroin use, we must continue our efforts to improve provider training. We need to continue to strengthen our prescription drug monitoring program, which includes upgrading technology to ensure that more prescribers can use it in a truly timely way. And we must build on the example set by the Board of Medicine and the Board of Nursing with emergency rules on the prescribing of opioids, so that the boards governing all prescribers adopt updated permanent rules this year. We know that we still need to enact a statewide drug court plan to expand existing drug courts and establish new ones across the state to help prevent people from slipping back into addiction and into crime. As we work to expand drug courts, we must also increase treatment capacity in order to ensure that those who go through our drug courts and others who are battling addiction have actual access to treatment services. While Farnham Center North in Franklin recently opened, and we have revised some licensing requirements to remove logistical roadblocks for providers looking to open a treatment facility, we continue to lag behind other states for treatment capacity. That's why reauthorizing our bipartisan healthcare expansion program as soon as possible is critical to our comprehensive approach to help save lives and combat this crisis. Medicaid expansion, which in New Hampshire was a bipartisan program called the New Hampshire Health Protection Plan, has already helped thousands of Granite Staters access substance abuse and mental health services since coverage began in August of 2014. And experts have made clear that reauthorizing expansion, which currently is due to expire in January of 2017, they've made clear that reauthorizing expansion is the single most effective step we can take to increase treatment capacity in New Hampshire, bringing tens of millions of federal funds into our state. Each of the individual efforts that I've discussed this morning and that you will all continue to discuss in this forum will be critical to combating the crisis. But we know that our work to stem and reverse this tide is ongoing. We are going to have to continue to fight together, each and every one of us, each and every single day, to build on our efforts to combat this crisis. We are truly all in this together. There are so many families and individuals, people in recovery, people struggling with addiction, who have been willing to come forward and talk to all of us and make clear the nature and pervasiveness of this illness and the need for us all to come together and do something about it. They have demonstrated incredible bravery and resilience as they come forward to talk about an issue and a problem that for so long has been something that none of us like to talk about. They are truly, truly very brave. Their bravery needs to be matched by our action. That's what everyone struggling with addiction, the families and friends who are trying to save lives, people in recovery who are doing so many efforts to try to make themselves available to help others who are struggling. That's what they all deserve from their elected leaders, is that we actually act to make sure that treatment is available, to make sure that we are using every tool at our disposal on the supply side, but also that we're doing everything we can, for instance, to provide resources to our schools, to our treatment providers, to our families and our communities, so that we can truly have the kind of capacity we need to stem and reverse this tide. It is going to be difficult, and it will require our constant vigilance and perseverance. But we're going to be successful, because this is New Hampshire, and we are Granite Staters, and we work together to do really hard things. We'll be successful. We'll beat this, and we'll be stronger and better for it. Thank you all very much.